Hi, so I'm going to discuss one of the common effects of testosterone on transgender men, which is hair loss and hair growth. So, according to the Endocrine Society, it takes about 6 to 12 months for the onset of facial hair, body hair, and scalp hair loss to start. And it takes about 4 to 5 years for facial and body hair growth to stop or to maximize, So that at about 4 to 5 years, that's sort of your maximum expected growth. You can't really expect it to go thicker or grow more or much more at least. So let's start from top to bottom. So first is the scalp. So with the scalp, you will notice your hairline receding. So it'll go up, right? And for some people, they do start to bald or experience hair loss, right? More than the usual. So you start to bald and you can't really know if this will happen to you or not. Um, there's no like guarantee that it will happen, and there's no guarantee that it won't happen. But one way to gauge whether or not it might happen to you once you get on testosterone is by looking at your family members. So if your family has a history with the men or the women, with hair loss, then it can happen to you. If not, then it's probably nothing to worry about, except if your testosterone levels are too high. So when your testosterone levels are too high, it can cause balding. And then, um, there are treatments available for hair loss. So one of the effective treatments is minoxidil. So you put minoxidil on your head 1 to 2 times a day, although once a day is supposed to be as effective as twice a day. So you rub it on your scalp in the morning and at least like an hour before you sleep, so to prevent hair loss. And then you also do grow nose and ear hairs, right? A little bit. It depends, but do expect nose hair. So you will want to buy nose trimmers. So whether it's the manual scissors or the electric nose trimmers. So there are a lot of cheap electric nose trimmers, and they're very convenient and easy to use, and it's just and you're done. But the problem with nose trimmers is they do break easily, so don't expect the motor to last more than 1 or 2 years. Next, facial hair. So you may, with limited or varying levels of success, you may have a mustache, a soul patch, and a beard. So some people have much more facial hair, some have less, and for the beard, could be like mine, just at the chin, or some people have hair all the way from the lower cheek all the way down here to the neck. So it really, really depends. There's no guarantees. There's no way to stop it if you go on testosterone. So it's one of the things that you have to consider. Definitely, when you go on testosterone, you cannot pick and choose what side effects or effects, masculinizing effects, you will have. Okay. You will have possibly more armpit hair. Also, you may grow more arm hair. In my case, nothing happened to my arms. So my arm hair is the same. I've always had arm hair. You may develop chest, belly, and back hair. You might also get a happy trail. You might also get hair around your nipples. No. So hair around your chest might be an issue when you get top surgery, because a couple of people have experienced itching after surgery, because like the hairs are growing inside. So something you might want to consider is laser hair removal before your surgery, just to prevent that kind of issue. For some people, it's not an issue at all. So it's really up to you. Talk to your surgeon before your surgery about the possibility of ingrown hairs. Pubic and butt hair. Almost no one talks about this, I think, but it's true. There's going to be more pubic hair and there's going to be more butt hairs. So get ready for that. And lastly are your legs. So for almost everyone I know, the leg hairs do get really, really thick and long. You might like it, you might not. So it really depends. Again, you cannot pick and choose. So what you get is what you get. And thanks for watching.